Hi, my name is Carlos Wong. I will be the physician assistant student taking care of you today. We're going to do several exams today. We're going to start with our general survey exam. We're going to do some vital signs, and then we're going to take a look at your head, your neck, your eyes, ears, throat. At this time, I'm just going to have you please take off your shirt, your shoes, and socks while I wash my hands, okay? All right. Okay, so we're going to start with our general survey exam. So what I'm looking for at the patient is I'm looking for any physical deformities and just looking at the overall health of the patient, noting for any odors coming from the patient, making sure that the stated age matches the apparent age, and we're also looking for facial expressions, making sure there's no pain, signs of pain or distress, and we're also looking for the overall grooming and hygiene of the patient. After that's been done, we're going to do a mental survey exam. Perfect. Okay, so now we're going to move on to vitals. First, we're going to take your height and weight, which we have done. Now we'll take your oral temperature. How we will do this is I will place the thermometer under your tongue. We'll leave that there for about a minute or so, or until it beeps. Once we have that, we'll have your temperature, and then we'll move on to your pulse. Okay? All right. Okay. I'm going to have you open wide. I'm going to place this right here. I'm going to have you hold that for me. Okay, so now I'm just going to move on to your radial pulse. May I see this arm, please? Perfect. We're just going to take your radial pulse. What we're looking for here is we're looking for the rate, the rhythm, the amplitude of that pulse, and we're going to count to 15 seconds, and then we're going to multiply that by 4. And then after that, we'll take your respiration rate, which we will then take a look at the rhythm and the depth of the respiration, and then we'll do the same. We'll count to 15 and count multiply by 4. Okay? All right. Okay, and then now I'm going to take a look at the respiration. Excellent, perfect. Okay, so it has been a minute or so, so I'll take the temperature for you. Perfect, thank you very much. All right, so now what we're going to do is we're going to move on to blood pressure. So for the blood pressure, what I'm going to do is I'm going to take the bladder of the cuff and I'm going to use it on your arm to measure if the width is at least 40% of your arm circumference, and then we're going to do the length, which should be about 80% of your arm. Okay, so we're going to start with the width, 40%. Excellent. All right, now I'm going to take the bladder and then make sure that it is 80%. Excellent, perfect. So now what I'm going to do is I'm going to find your brachial artery. Excellent. What I'm going to do is I'm going to place the cuff around it, making sure it's 1 inch above the antecubital fossa, and then I'll find your radial pulse, and then what we're going to do with that is we're going to make sure we find that, and then I'm going to palpate it to make sure that we can find your systolic palpable pressure. That's when I'll stop feeling the actual radial pulse, okay? All right, may I see your hand? I'm gonna have you extend it. Perfect. Excellent, perfect. All right. Okay. We're gonna have it above the heart level. Perfect. Perfect, okay. Now I'm going to deflate it. All right. And then now I'm going to I'm going to do your real blood pressure. What I'm looking for here is I'm looking for two things, two Kirchhoff sounds. The first Kirchhoff sound is how we will determine our systolic pressure, and then the diastolic will be our last Kirchhoff sound. Once I start, I will palpate the cuff to make sure it's 30 millimeters above mercury, above the number that we just got, and then we're going to then deflate that 2 to 3 millimeters over mercury per second, just to make sure we get an accurate reading. Okay, I'm just going to make sure I tighten this for you real quick. Okay, excellent. And are you okay?
Yeah.
Perfect. Okay, I'm going to have you extend your arm out for me. I'm going to put my stethoscope. Okay, perfect. And then we are going to make sure we do it on the other arm just to make sure we get accurate readings. And we can do this either standing or with you in a supine position. Okay, alrighty. So now what we're gonna move on to, we're gonna do our skin exam. So for this skin exam, what I'm gonna have you do is I'm just gonna have you please step up for me. All right, so we're looking for any deformities, any lesions, cuts, anything of that nature that may be out of the ordinary. I'm just gonna have your hands up like this for me, just examining every part. Perfect. I'm going to lift your shorts up, looking at the feet, legs. Perfect. Now I'm just gonna have you turn around. We're gonna look posteriorly. Perfect. I'm gonna have you extend your arms out for me again. Excellent. I'm gonna lift up your shorts. All right, perfect. So now I'm gonna have you put your hands on the table for me, and then I'm just gonna have you lift up 1 foot at a time, okay? We're looking for any ulcers that might be there. Perfect. I'm gonna have you lift up the other one. Excellent, perfect. You can have a seat on the table right there. Perfect, so then I'm just gonna finally take a look at your fingernails and your toenails just to make sure there's no cyanosis, brittleness, or any clubbing of any sort, okay? Perfect, okay. So now we're going to move on to our head, face, and scalp exam. So we're going to take a look at the head and the scalp. And before that, we're going to make sure we actually take a look at your skin. We're gonna take a look at the temperature, moisture, texture. We're gonna look at the mobility and tuber of the skin, okay? So first we're going to take a look at the arms first. Okay, tuber, perfect, okay. Excellent. Great. All right, now we're going to do around the legs. Perfect. All right. Okay, now we're going to do around the calf area. Perfect. All right. So now we're moving on to the head, scalp, and the skull exam. So we're going to inspect the head and skull first, making sure that there's no deformities, shape looks good, contour, nothing out of the ordinary. And then we're going to do the same with the scalp, just making sure there's no dandruff, lice, nits, anything that may be out of the ordinary as well. Okay, so I'm just going to take a look. Okay, perfect. Perfect. I'm going to have you look down for me. Perfect. Alrighty. So now what we're going to do is we're going to actually palpate the skull and the head just to make sure there's no deformities, tenderness, or anything that may be out of the ordinary as well, okay? Perfect. Now we're going to palpate the scalp to make sure that there's no, that there's mobility and no tenderness of any sort, okay? Looks great. And then we're going to palpate your temporal arteries just to make sure that there's pulse and no tenderness around that area, okay? Perfect. So now we're going to move on to the TMJ joint. We're going to make sure there's no crepitus, no tenderness, anything that may be out of the ordinary, okay? Perfect. I'm going to have you open up your mouth and down, close. Perfect. I'm going to have you move it side to side, in and out. Excellent, perfect. So now finally, I'm going to palpate the forehead, the supraorbital ridge, zygoma, maxilla, and then your parotid gland as well, okay? Perfect. Okay. Okay. Excellent, perfect. Alrighty, so now we are going to move on to our eye exam. So for this, I'm looking for the eyelids, eyebrows, and the actual, let me see, eyelashes as well. For the eyelids, we're looking for the closure, and we're looking for the overall position of it as well, okay? So for this one, what I'm gonna do is I'm going to first take a look at your cornea. I'm gonna make sure that there's no blood or no injections in it, making sure that I'm looking at the anterior chamber of it. So I'm gonna have you look, I'm gonna pull down your eyelids, I'm gonna have you look up for me. Excellent. Now I'm gonna have you look down. Excellent, perfect. So now what we're gonna do is we're gonna do the near visual acuity test, okay? So what that's gonna entail is I'm gonna have you hold your, this Rosenbaum chart at arm's length, and I'm gonna have you close one eye for me, and then I'm gonna have you read the lowest number that you can.
563-297.
Perfect. Now I'm gonna have you do the other one.
563-297.
Perfect. Now I'm gonna have you do it with both eyes.
563-297.
Perfect. Now I'm also going to note any symmetry, or note the symmetry of the pupils and then the pupil size itself, okay?
Mm-hmm.
All right. All right, perfect. So now we're going to we're gonna test the extraocular muscles. What we're gonna do is we're going to go in an H motion. I just want you to look at the light for me with just your eyes. Do not move your head, okay?
Sure.
Okay, so now we're going to do what's called the visual fields test. How I'm going to do that is I'm going to have you raise up your fingers once you see my fingers come into view. I'm going to go from above, from the side, and from below. Okay, I'm just going to get a little close. I'm sorry for this. Perfect. Excellent. Perfect. Okay. So now what we're going to do is we're going to do what's called accommodation and convergence. So for accommodation, I'm going to have you look at the wall for me, and then once this comes into focus, I want you to focus your eyes on the pen, okay? All right. Excellent. Okay. For convergence, I'm going to have you focus on the pen, and I'm going to slowly come at you, okay? Excellent. Okay. So now we're going to do the lid lag test as well. I'm going to have the pen go up and down slowly, and just with your eyes only, okay? All right, perfect. So now we're going to do the tangible lighting, where we're going to take a look at your cornea, take a look at the anterior chamber of the cornea, making sure we see crescent shadows, okay? All right. We're going to go from the side. Excellent. Other side. Perfect. All right, and then we're going to finally do what's called the direct and the consensual. Let's see. We're going to constriction, the direct and consensual constriction. I'm going to have my hand on the middle of your face, and we're just going to test the pupillary constriction. Okay, we're going to start with your left eye first. Excellent. I'm going to do the consensual side. Excellent. Okay, I'm going to do the other way now. All right, we're going direct first. All right, and then we're going to do the consensual. Perfect. All right, so now we're going to move on to our fundoscopic exam. What this entails is I will have my ophthalmoscope, and I will kind of dim the lights a little. For right now, we won't, but I'm going to just take a look at the overall corneal light reflex and the symmetry of your eyes, okay? Mm-hmm. Okay, I'm just gonna have you look at the light for me, okay? Mm-hmm. Excellent, I'm just gonna do the other eye now. Perfect. So now what I'm gonna do is I'm going to stand at a 15-degree angle from this side, and what I'm doing is I'm looking for the red light reflex. In this, what I'm looking for is, for example, the bulbar, conjunctiva, and the sclera. I'm looking for the, just looking for any sort of like deformities, any sort of like lesions, anything of that nature that may be of concern, okay? All right, so I'm going to look from this side first. I'm just going to have my hand for support. Okay, I'm gonna move in slowly, okay? All right, now I'm gonna do the other side. I'm gonna take a look at your eye with just the light. All right, see the red light reflex? Okay, now I'm gonna go in. Excellent, perfect. All right, so now what we're gonna do is we're going to move on to our ear exam. So for this, what we're gonna do is we're gonna take a look at the auricle of the ears, inspecting it, making sure there's no lesions, no swelling, no deformities of any sort, and then I'm going to palpate the actual auricle, tragus, and the mastoid for any sort of like swelling or anything of that nature, okay? All right, I'm gonna start with this ear first. Okay, got the auricle, tragus, mastoid. All right, I'm gonna do the other ear now. Tracheus, and then your last one. Excellent. So now I'm going to do the whisper test. What this entails is I will cover one of your ears, and then I'm just going to whisper a 2-syllable word. You just repeat it back to me, okay? Alrighty. Soccer. Baseball. Perfect. Okay. So now what I'm going to do is I'm actually going to grab my otoscope, and I'm going to actually take a look into your ears. For this, I want to make sure I put a speculum on it just to make sure that we can take a look closer in the ear canal. Okay, perfect. So what I'm doing is I'm going to look inside the I'm going to look inside your ear canal. What I'm looking for is for any like discharge, any earwax, any foreign objects, anything that might not belong there. And then we're also taking a look at the overall color of the tympanic membrane, making sure it's a pearly white color. And then finally, we're also looking inside the structures of that tympanic membrane, the let me see, the omo, the malleus, and then we're looking at the cone of light as well, okay? So I'm gonna start with this ear first using my pinky as a fulcrum support. I'm going to pull on your auricle so I can, up and down, just to make sure I get a better view of your ear canal, okay?
Mm-hmm.
Excellent. Okay, now I'm going to do the other ear, doing the same thing, using my pinky as a fulcrum. Excellent. Perfect. Okay. So now we're going to do the nasal exam. So for the nasal exam, what we're doing is we're looking for the overall symmetry of the nose, looking for any deformities, and just making sure that there's nothing that would be out of the ordinary, okay?
Mm-hmm.
First, what we're gonna do is we're going to palpate your frontal sinus and then your maxillary sinus, okay?
Mm-hmm.
Perfect. All right, now I'm going to have you do our nasal papillary test. What I'm going to have you do is I'm just going to have you cover one of your nostrils with your finger and then breathe in from the other side, okay? Perfect. I'm going to have you do it from the other side. Excellent. Perfect. So now I'm going to actually use my otoscope again using a new nasal speculum. Okay. I'm going to look inside the nares of the nose. I'm noting for the nasal mucosa, looking for any polyps within the membrane, and I'm also looking for any perforations or septal deviations as well. I'm gonna have you lift up your head a little bit while I just lift your nostril a little bit, okay? Turn this on. Perfect. Okay, I'm gonna do the other side. Excellent, looks good. Perfect. Okay, so now what I'm gonna do is I'm going to do your oral exam. For this oral exam, I'm gonna first put on some gloves first, okay? And then I'm just gonna grab a tongue depressor as well. Okay, so let me grab my pen light. So what we're doing now is we're noting, we're taking a look at your oral cavity. We're taking a look at for example, we're taking a look at the lips, the teeth, the, let me see, the gingiva, the tongue, the floor of the mouth, and let's take a look. We're noting for any deformities, any swelling of any sort, any bleeding. Perfect. And then I'm gonna have you lift up your tongue. Perfect. All right, now I'm going to depress the tongue using my tongue depressor. I'm gonna have you say ah. All right. So what I'm doing is I'm taking a look at the posterior pharynx, looking for the conditions of the tonsil. And at the same time, what I'm doing is I'm looking at the perforation of the, not perforation, of the uvula, and just making sure that your, everything looks good. Perfect. All right. So now I'm gonna have you stick out your tongue. Perfect. I'm just noting that the midline of the tongue, and then making sure that there's no deformities, any lesions, any bumps on there as well. Perfect. All right. So now with that, I'm going to move on to palpating your tongue. For this, I'm gonna use gauze. What I'm gonna do is I'm gonna have you stick out your tongue for me. Perfect. Perfect. Sorry. All right, just gonna palpate, making sure of any deformities, any swelling of any sort. Looks good. Perfect. All right. So finally, what we're gonna do is we're going to do your neck exam, okay? So first what we're gonna do is we're gonna take a look at your trachea, making sure that it's midline. I'm gonna palpate it just to make sure it's midline. Perfect. Okay, so now I'm gonna also take a look at your thyroid as well. I'm gonna have you move your leg slightly to the right from me so I can get behind. Perfect. So I'm going to take my pinky, locate the clavicle, and then put my forefinger using the bed of my index finger and middle finger. I'm gonna look for your right and left lobe of the thyroid. Perfect. I'm gonna have you first swallow. Perfect. Okay. Now I'm going to push the trachea aside so I can take a look at the left lobe while palpating. I'm gonna have you swallow. Perfect. Now I'm gonna do the right side. I'm gonna have you I'm gonna have you swallow. Perfect. Now I'm gonna do the isthmus, the middle of the thyroid. I'm gonna have you swallow again. Palpating. Perfect. All right. So now you can face me again. So finally what we're gonna do is we're gonna take a look at your lymph nodes. For the lymph nodes, what we're gonna do is we're gonna make sure for any deformities, any sort of like swelling, anything that may be out of nature that we don't wanna see, okay? We're gonna start with your pre-auricular area, post-auricular. We're gonna do occipital. We're gonna do submandibular. We're gonna do tonsillar, submental. Perfect. Let me do it one more time. Perfect. Now we're gonna do the anterior cervical chain. Excellent. We're gonna do the posterior cervical chain. Excellent. And then we're going to do a deep chain. So I'm gonna have you lean towards the right for me. We're gonna note the deep cervical chain on the left side. All right, now I'm gonna have you lean to the other side. Perfect. And finally, we're going to do the supraclavicular lymph nodes. What I'm gonna have you do is I'm just going to have you inhale for me and exhale. Excellent. Okay, so with that, I believe your exam is done, and I hope you have a great day.
Thank you.